When most people think about allergy medications, they picture something that relieves symptoms after they start. But Cromolyn Sodium works differently. Instead of putting out the fire, its job is to stop the sparks from flying in the first place. This medication stabilizes mast cells, which release chemicals that trigger itching, inflammation, sneezing, and other allergy symptoms. In simple terms, it acts like a preventive shield. That's why it works best when used consistently to help prevent symptoms before they begin. Depending on the condition, Cromolyn Sodium comes in several forms. One common option is a nasal spray for congestion, sneezing, runny nose, and itching. However, it doesn't usually work immediately and may take several days or even 1 to 2 weeks to reach full effectiveness. Unlike some nasal decongestants, it doesn't cause rebound congestion and may be used longer under medical supervision. It's also available as eye drops for red, watery, or itchy allergy-related eyes. If you wear soft contact lenses, remove them before applying the drops and wait a few minutes before putting them back in. Another less common form is an oral solution used for certain allergy-related and digestive conditions. It's typically mixed with water and taken before meals. Side effects are generally mild and may include slight nasal burning, temporary eye stinging, headaches, or mild stomach discomfort. The key is consistency. Using Cromolyn Sodium only occasionally may not provide the desired results. When used as directed, it can be a useful tool for controlling allergies, always under guidance from a healthcare professional.